Welcome, and thank you for turning to the experts at Home Helpers for help in caring for your loved one with diabetes. Your first step as a caregiver caring for someone with diabetes is to understand the disease and how it affects your loved one. Diabetes is a disease that can affect everything from your loved one's diet to their mood and even their cognitive abilities. In this presentation, we will learn about the disease, its possible complications, some common misconceptions about diabetes, and how you can help someone living with diabetes. Diabetes occurs in two primary forms, known as type 1 and type 2. Type 1, sometimes called juvenile diabetes, describes a condition in which the pancreas produces little or no insulin, a hormone that allows sugar to enter cells to produce energy. Type 2 diabetes is far more common and involves the body's resistance to insulin or inability to produce enough insulin. Both are chronic conditions with no known cure. Here are a few facts about diabetes. According to the American Diabetes Association, 29.1 million children and adults in the U.S. had diabetes when the latest statistics were collected in 2012. That equals about 9.3% of the population. Of those 29.1 million people, only about 1.25 million have type 1 diabetes. More than 25% of Americans over 65 have diabetes. Diabetes can lead to many complications, including heart disease and stroke. Ultimately, diabetes can lead to death. In fact, it is the 7th leading cause of death in the United States. In addition to thousands of lives each year, diabetes costs the country an estimated $245 billion annually in things like medical costs, lost wages, and disabilities. Diabetes cannot be cured, but it also cannot be ignored. Failure to control the disease can have devastating effects, including cardiovascular disease, kidney disease, blindness, stroke, limb amputation, nerve damage, and dementia. Perhaps due to its prevalence, diabetes is a disease surrounded by misinformation. Let's take a moment to set the record straight on a few of the more common misconceptions. First, many people believe that diabetes is not a serious disease. But in fact, diabetes causes more deaths each year than breast cancer and AIDS combined. 2 out of 3 people with diabetes die from heart disease or stroke. Another common myth is that if you are overweight or obese, you will eventually develop type 2 diabetes. This also is not true. While being overweight is a major risk factor for developing this disease, other risk factors, such as family history, ethnicity, and age, also play a role. Unfortunately, too many people disregard the other risk factors for diabetes and think that weight is the only risk factor. But the fact is, most overweight people never develop type 2 diabetes, and many people with the disease are at a normal weight or only moderately overweight. Some believe that eating too much sugar will cause diabetes. This is not true. Type 1 diabetes is caused by genetics and unknown factors that trigger the onset of the disease. Type 2 diabetes is caused by genetics and lifestyle factors. Being overweight does increase the risk for developing type 2 diabetes, and a diet high in calories, whether from sugar or from fat, can contribute to weight gain. But sugar alone is not the cause of the disease. However, research has shown that drinking sugary drinks is linked to type 2 diabetes, and the American Diabetes Association recommends that people limit their intake of sugar-sweetened beverages to help prevent the disease. A healthy diet and regular exercise are recommended to manage weight and lower your risk. Next, people with diabetes can't eat sweets or chocolate. This also is not true. If eaten as part of a healthy meal plan or combined with exercise, sweets and desserts, including fruits, can be eaten by people with diabetes. They are no more off limits to people with diabetes than they are to those without. The same is true for other carbohydrates, such as pasta, bread, and potatoes. According to the American Diabetes Association, 25% of Americans aged 65 and older have diabetes, but age alone is seldom to blame. Economic factors also can contribute to an elderly person's risk. Seniors on a fixed income may skimp on diabetes care, medications, or proper nutrition, all of which are important to avoiding or managing the disease. Conditions such as arthritis, which are more prevalent with age, can keep older adults from regular exercise, therefore putting them at higher risk. Diabetes is a lifelong condition that requires numerous lifestyle changes for proper control and a healthy life. Lifestyle changes are probably the most difficult and important part of managing diabetes. Habits that have been formed over a lifetime now need to be changed. As a caregiver, your patience and encouragement are important. These lifestyle changes, including change in diet and exercise routines, along with fear of the disease itself, can cause stress for the person living with diabetes. You can help by encouraging your client or loved one to talk about their feelings, their worries, and their frustrations. Join them in a stress-reducing activity, such as yoga, meditation, or a long, relaxing walk. Dealing with a chronic disease can lead to feelings of depression. If you suspect that your loved one is struggling, encourage them to find help through a support group or from their doctor. You've heard it before, and it's true. Knowledge is power. Join your loved one in becoming educated about diabetes and how it can be managed. The American Diabetes Association is a good place to start. One of the biggest lifestyle changes necessary in managing diabetes is diet. A healthy diet is imperative to controlling blood sugar. Protein is especially important to the body's ability to regulate blood sugar, and a diabetic's diet should include plenty of lean protein. Good sources of this vital nutrient are fish, eggs, grilled or baked chicken, beans, unsweetened yogurt, string cheese, and nuts and seeds. Every healthy diet includes plenty of fruits and vegetables. That includes dark green leafy vegetables such as spinach and kale. These powerhouse foods are so low in calories and carbohydrate you can include as many as you wish in your diet. Citrus fruits such as grapefruits and oranges pack a high dose of soluble fiber and plenty of vitamin C. Sweet potatoes are a starchy vegetable full of vitamin A and fiber. Try them in place of regular potatoes. Berries, such as blueberries and strawberries, are full of antioxidants, vitamins, and fiber. Try making a parfait alternating the fruit with light non-fat yogurt for a new favorite dessert. Tomatoes, no matter how you like them, pureed, raw, or even in a sauce, are full of vitamin C, iron, and vitamin E. Having diabetes doesn't mean you can't enjoy snacks and even a treat now and then. The key is to do so in moderation. Make wise choices and pay attention to portion size. A few good choices include a small handful of almonds, celery sticks with a tablespoon of peanut butter, a hard-boiled egg, a cup of light popcorn, or a piece of string cheese. As a caregiver for someone with diabetes, you need to know the signs of dangerously high or low blood sugar and what to do about it. A person with high blood sugar may exhibit increased thirst, dry mouth, vomiting, frequent urination, nausea, or shortness of breath. A person with low blood sugar may be shaky or nervous, sweaty, irritable, tired, exhibit signs of unusual hunger, or become confused. As someone caring for a person with diabetes, your job includes motivating and encouraging the person to practice healthy habits. The best way to do this is by modeling good behavior. Practice good, healthy eating habits and make physical activity, like taking walks, a big part of your life. Make healthy eating easier by stocking the kitchen with healthy choices. Keep a big bowl of apples on the table and have the family make available healthy snacks such as string cheese and low-carb yogurt. Sometimes the best way to encourage someone to do better is simply to stop talking and start actively listening. Listen to their complaints, their fears, and celebrate their successes, no matter how small. Our experts at Home Helpers have assembled a few helpful hints to help you as a caregiver. Do not blame or nag if your loved one falls off the wagon or eats something they shouldn't. Don't manipulate, give unsolicited advice, or try to force your loved one to make a decision. Do whatever you can to eliminate excess stress on your loved one. Offer gentle reminders to take medicine, test blood, or urine. Above all, be patient. Your loved one may get frustrated at times. Encouragement and kind words might be the best help you can give. If you want to know more about diabetes and the care of someone with the disease, turn to a reputable source such as the American Diabetes Association or Mayo Clinic website at mayoclinic.com. Caregiving is a big, often exhausting job. Home Helpers is here to lend a hand, whether it's to answer a caregiving question, provide an hour or two of respite, or around-the-clock care. Consider letting our trained, compassionate caregivers make your life easier.